6 treatment methods for substance abuse disorder. The consistent prevalence of crimes has strongly been linked to substance abuse. Research has made it clear that education, targeted towards youth, provide the best way to significantly reduce this problem. eMedicine.com shares that people abuse substances such as alcohol, tobacco, and other drugs for varied and complicated reasons, but it is clear that the society pays a significant cost. Although use of some drugs, such as cocaine, has declined in recent years, use of other drugs, such as heroin and club drugs, has increased. It is crucial that everyone learns about this growing concern. Common treatment methods for substance abuse disorders. As shared by the Child Welfare of the U.S. Department of Health and Human Services, there are several ways to categorize the treatment, based on the theoretical information and treatment or level of care. The following are the common approaches that can be used to treat substance abuse. Cognitive behavioral approaches. It helps patients identify the cause why they use drugs or alcohol and develop specific skills to deal with these problems. Psychological disorders are often linked with this concern, thus making this treatment all the more effective. Motivational enhancement treatment. This combines some parts of cognitive behavioral treatment, though it centers on improving and maintaining patients' change and motivations. Rather than insisting to accept that the patient has a problem, this psychotherapy concentrates on the person's needs and weaknesses between their present behavior and their goals. Contingency management. This involves motivational enhancement treatment and elements of rewards and reinforcements. For instance, rewards are offered for established positive behaviors. Therapeutic community. A therapeutic community is based on cognitive behavioral therapy and the belief that treatment is best given within the environment of a community on patients with similar histories. Such model was developed for individuals with antisocial personality traits besides substance abuse. As patients confront each other's attitudes and behaviors, they understand a huge deal on their own character and learn from others as well. Trauma-specific treatment service. This treatment addresses the impact of a particular trauma on the life of a patient. Such approach focuses on trauma healing and recovery as an integral part of the therapy. A number of trauma-specific treatments for women has been developed recently. Trauma-informed treatment services. It focuses on the understanding of trauma as well as its impact on recovery and substance abuse disorders. This treatment approach accepts that a considerable percentage of patients have sustained emotional, sexual, or physical trauma, and their disorder may be the consequence of self-medicating behaviors when dealing with PTSD, post-traumatic stress disorder, symptoms. The inaccessibility of treatment for addicts in the news. As per the latest news from the United Nations Information System, most people don't have access to effective treatment and care. The UN Information System presents the details on the resources assigned for the drug and alcohol prevention and treatment problems in 147 countries. According to UN News, drug dependence is a disorder that can be treated effectively, but, unfortunately, the large majority of persons who need it do not have access to treatment. The data presented in the new system illustrates the huge gaps that still exist in the area of drug dependence treatment. But more and more countries realize the benefits of treatment for drug and alcohol dependence, not only for the individuals themselves, but also for the society and the economy. Are you suffering from an addiction or psychological disorder? Call Hawaii Island Recovery at 866-515-5032.